Hello. I'm going to be talking about the potential and possible impact of the Brexit, but in some ways the changes are starting to take place and they're being implemented into a period of time that is probably one of the most challenging that the NHS has faced in its 69 and a half years of existence. So probably the most famous picture from the Brexit campaign was this one. I guess you remember it. Who can forget it? And it immediately connects Brexit with the NHS. And what I want to do today is just show you how it's connected in a number of different ways and how that might impact upon us. So we tend to think of the NHS as a national competency for each country, for the UK particularly. So we tend to think of it as not an EU issue. And yet there are many issues here on this slide that point this out. I should point out that I haven't received any EU research. But what I want to do, EU-funded research, but what I want to do is focus on two aspects. One is patients and one is staff. So in terms of patients, first of all, should come up in a second, the Hiccard, 27 million people in the UK have an Hiccard. That's about 40% of the population. I was going to ask if I could have a hands up and how many had one, but I can't really see you, I'm afraid, with the lights. Some, yeah, a few, maybe not 40% as such. But this is one of the main ways in which we have a relationship in terms of patients. Some of the highlight has been that the UK has paid out £650 million to European countries, but we've only got £50 million back in return. Now, most of this money is associated with pensioners, but others point out that it's actually a very small amount. Brexit, will this lead to the end of EHIC? Well, potentially. There's an agreement in principle, but if it was lost, there's a danger, as Kelly was pointing out, that 190,000 pensioners might come back. We would need 1,600 more clinical staff and a cost of £500 million. So the NHS has launched an overseas visitor and migrant cost recovery programme, snappy title, but so far it hasn't recovered anything like the amount that the government thought that it would do, some 97 million. The second aspect I want to look at is staffing, and certainly the referendum generated a lot of interest, and this classic photo of the multinational nature of NHS staff points this out. But just to highlight this, really, the NHS staff is made up of many other different countries. Yes, the EU is important, but many other parts of the world are represented. So if we take out a proportion of EU staff from the NHS, what impact will this have? Potentially quite serious impacts. At the moment, about 1 in 10 doctors come from the European Economic Union, slightly larger than the EU. And currently 7% of nurses come from the EU. So we're quite heavily dependent on our European clinical colleagues. But we have to understand that this is being put in place at a time when the NHS is particularly short of many key workers, GPs and nurses particularly. 1 in 10 nursing posts are vacant. Added to that, the tweet on the right-hand side from Bournemouth, 28 workers, EU workers have left Poole Hospital and 44 the Royal Bournemouth. And this is generating a change which is kind of a perfect storm, really. The red line pointing out the number of workers leaving the NHS and versus the number of people joining. And we see one group leaving at a greater rate than the other. The other issue that relates to this is nursing workforce, and we've seen a dramatic drop in the number of nurse registrations per month from over 1,000 last year to 46 this year. So we've got tremendous pressure being put on the NHS. But how will this play out in terms of the broader impact upon you and me and our clinical care? Where will the NHS sit? And I thought this would be quite useful just to put in terms of our spending. And clearly, our economic fortunes are going to be closely tied up with government revenue. At the moment, we spend about the European average in terms of our health spending, more than Spain, but less than France and Germany. This might have a serious effect upon our future to be able to fund healthcare at that sort of level. So, in terms of what we get for our spending, generally speaking, according to the Commonwealth Fund, we seem to do very well. We're a good, high-performing health system. But this is particularly under threat as we move into the period closer to the Brexit day and beyond. And this is particularly important when we consider the current deficit that we're facing in the NHS, 5.9 billion, 6 out of 10 trusts in deficit. Half are planning to cancel or delay spending because of financial pressures. If we add in staffing issues particularly, we're going to be facing a terrible situation. So if we add in the issues that I've been talking about, the mix of EHIC issues, staffing issues, financial issues, we could see a situation of worse access, possibly lower spending, and poorer quality as a result. So the decision of Brexit will have far-reaching implications upon the NHS. So although a lot of uncertainty exists, how we respond and how we as a country respond and how we address that in terms of the NHS will say a lot of, not just about the EU, but will say a lot about our attitude towards the NHS as we approach its 70th birthday. Thank you.